والسلام على رسول الله وعلى اله وصحبه ومن والاه. اما بعد، ان شاء الله today باذن الله we will talk about the role of general dentist and oral surgeon in maxillofacial trauma as the first step for maxillofacial surgeon. First of all أود أن أشكر طبعا جميع الحضور الكريم أولا، ثم السبورت للقسم ولينا في الشغل والحمد لله رب العالمين. طبعا للدكتور علاء أستاذنا ورئيس القسم وللإدارة مشكورين جميعا. برضو يعني في هذه الآونة يعني الحمد لله رب العالمين في دور كبير وفي تحفيز للجميع من الزملاء الجنرال براكتيشنر ان هم ياخدوا التخصصيه في كل قسم، كل واحد يبقى انترستد فيه. دي بتفرق كتير طبعا ان شاء الله بكره وبعده، بحيث ان يبقى الاكتيفيتي او الانترست لكل واحد او السبيشاليتي في العموم في الاونه الاخيره بتبقى اكتر افضل من ان يبقى الشغل كله يعني ايه شغال كل حاجه او بتاع كله يعني. فان شاء الله ربنا ييسر نبدا ان شاء الله. What's the definition of dentoalveolar trauma and causes, diagnosis and management? Dentoalveolar trauma is that injury involving the teeth, alveolar portion of the maxilla and mandible, in addition to the adjacent soft tissues, including teeth avulsion, fractures of the teeth, or alveolar process, and lacerations of the soft tissue. These injuries are associated frequently with accidents and personal violence. Unlike other hard tissues, teeth have a special nature for dealing or treating hard tissues injuries in the body. Tooth enamel injuries are unable to heal or repair themselves. The causes involve RTA, road traffic accidents, or personal violence, as what we see in the streets with other person or conflict. Contact sports, as is very obvious, as we see in many sports like football, basketball, or handball, or any other ball with contacts. Many of us don't forget what happened in Qatar 2022 World Cup football at with the player in Saudi Arabia, which has with the contact is the fracture mandible. Falls, another causes, epileptic seizures, iatrogenic damage during tooth extraction, endoscopy, and or endotracheal intubation. The role of the general dental practitioner depends on the intervention and attention for this case, because proper treatment can be given only after accurate diagnosis. The diagnosis process should be immediately. Diagnosis for this patient will have a great role in the treatment, including history of the patient, history of the trauma, personal data for the patient name, age, male or female, site of injury, if it is injury occurs in a contaminated place or a clean place, time elapsed when the trauma was happened, action, the onset of trauma, nature of the trauma. Is this is the trauma with direct trauma, as with an indirect trauma, with this trauma with a sharp object or not, or any other object. Medical history of this patient is very important and cannot be neglected for treatment of this patient. If this patient is medically compromised, patient normal, neurological status of the patient should be taken in consideration also. For the examination of the patient, we should have to examine extraoral soft tissues, intraoral, and the fracture of the tooth or alveolar process and teeth also. Lacerations and abrasions and contusions of the skin, which occurs, and it depends on the depth and extension of it through the thickness of the lip and cheek or in the face, as for this case. If there is any vital structures, such as the parotid duct, facial nerve, crossing this line of lacerations or not, oral and maxillofacial surgeon should be best treated these major lacerations and treat it well. Commonly associated with dentoalveolar injuries, and before the treatment, examination should be done properly. Clinical examination by palpation, vision. Also, the use of radiographic should be taken in consideration. Here, there is a avulsed teeth, and in the radiographic, we see fractures of the root at the middle third. Other teeth has fractured. For these cases, this is an intrusion and extrusion of teeth, abrasion, labial displacement, or lacerations. This is a patient have been exposed to trauma. Then his teeth, which at the last picture, last photo or picture, has been treated by the use of composite and wiring. For this patient, another case, and another case for this patient also. The use is, we should have to clean the wound with the use of sterilized gauze, sponge, and examination of the lacerations if there is any foreign body. As this case, we see this patient has exposed to trauma, and the foreign body is this stone. Also, examination of the floor of the mouth and lips and areas, if there is areas of bleeding or not. For this patient also, by examination, there is parasymphyseal fracture in the 3D, and here, after exposure of the patient during operation, there is a symphyseal fracture. For this patient who has exposed to trauma, there is an exposure of the supraorbital and the frontal region, large laceration, and this is second picture after 1 month of trauma. Thank you.